warm good evening and good morning to everyone present here. So, this is the 8th webinar conducted by IET Kanyakumari local network this year. So, we have a good topic for this day, which is robotic surgery. So, as far as we have a good eminent personality with us, who is the resource person, Shefali Vishwakarma. So, we kindly welcome her and all the office bearers of IET Kanyakumari local network and all the participants to this event. So, before handing over the session for the welcome address, I would like to say one single thing, which is there are a lot of people who are volunteering in IET, and we can see a single family itself is completely volunteering in IET. So we already had Dr. Shefali Vishwakarma sir with us for the session. Then we had Xavier Vishwakarma sir for another session, and today we have Shefali Vishwakarma sir ma'am for another session. So this is a great dedication which shows their full-hearted support for IET, and as you know, they are from Canada and they are here in the early morning, just about 6:30 a.m. So let's jump into the session. So to start the session, I would like to hand over the session to Dr. Geoffer sir, who is the chairman of IET Kanyakumari local network, as well as the principal of Arunachala College of Engineering for Women, to welcome the gathering and introduce the chief guest of the day. Over to you, sir.
Thank you, Geoffer. So, good evening, all of you. So, we are here to have a webinar on robotic surgery. You are aware of that IET KKLN is organizing every month a webinar that will be useful for the students and the staff as well as research scholars. In continuation of that, so this month's seminar, that is webinar, is robotic surgery. You may know that robot is going to rule the world. Now it occupies almost all the areas in day-to-day life, as well as research, industry. So wherever, so the robotics play a major role. So knowing robotic surgery is very, very important because robotics play a vital role in surgery. So we have an eminent speaker today. So we would like to extend a special welcome to our speaker as well as the guest of the day, Ms. Shefali Vishwakarma, who is going to speak on the topic robotic surgery. On behalf of IET KKLN family, I welcome you, ma'am. I am very happy to welcome Dr. Vishwakarma, and also I congratulate Dr. Vishwakarma sir because recently he got postdoctorate. Congratulations and welcome you, sir. Next, I would like to welcome the Secretary of IET, Dr. Marsaline Beno, Vice Principal, St. Xavier's Catholic College of Engineering, who is the driving force of this IET KKLN. On behalf of everyone, I welcome Dr. Marsaline Beno for this webinar. I am happy to welcome Treasurer of IET KKLN, Dr. Judson, Professor, Department of ECE, St. Xavier's Catholic Engineering College, for this webinar. Welcome you, sir. My delightful welcome goes to the Vice Chairman, Joint Secretary, Joint Treasurer, CCC member, Executive members, and IET YP Chairman. Welcome you all. My special welcome to Engineer Geoffer, who is coordinating this event, not this event, all the 8 webinar. So he is the coordinator. So I express my sincere thanks to Geoffer as well as welcome Engineer Geoffer for this webinar. I also welcome all the participants, those who are joining through online mode. Welcome you all. I hope this webinar will be useful for you. So now I take this opportunity to welcome the speaker of the day, Ms. Shefali Vishwakarma. She is a final year student at Simon Fraser University in Canada. She is pursuing a Bachelor of Science program in Molecular Biology and Biochemistry. She has worked as a research assistant at Ballard Power and a Bioinformatics Research Assistant at Agriculture and Agri-Food Canada. Shefali is an active volunteer of Chartered Engineers Pacific, a group representative 5 UK-based professional institution in Western Canada. Apart from volunteering at various events organized by Chartered Engineers Pacific, she has been a winner of IET present around the world Vancouver Heats 2018 and IET Speak Out of Engineering Vancouver Heats 2021. So we have such a fortunate speaker today. With gratitude and honor, we are happy to welcome our speaker to continue the proceeding. Welcome you, ma'am.
Thank you. I appreciate your kind introduction. Okay. So, good evening, IET Kanyakumari Network, and greetings to all our viewers joining from other regions. My name is Shefali Vishwakarma, and I will be presenting on robotic surgery and the recent advancements in this field. But before jumping into the presentation, I would like to give a little background about myself. Next slide, please. I am currently in my final year for a Bachelor's of Science program in Molecular Biology and Biochemistry at Simon Fraser University. Over the past few years, I've been associated with the Chartered Engineer Pacific, a group representing IET in Western Canada, as a volunteer. I've also been a participant in many of their student competitions hosted by them. During the course of my degree, I've been fortunate to work under biologists and engineers, which has helped build my foundation for my interest in biomedical engineering, which is the all-encompassing field for my presentation today. Before we dive into surgical robotics, I will go over the background information to make sure that we're all on the same page. Next slide, please. First, what is biomedical engineering? Biomedical engineering, which you may know as bioengineering, is a multidisciplinary STEM field that combines a large number of disciplines such as medicine, physical science, mathematics, and engineering, but primarily engineering and medicine. Basically, connecting the gap between engineering and medicine by utilizing the problem-solving approach from engineering and applying it towards medical biology science, with a common goal of enhancing the health of an individual through advancements in tools and techniques. Next slide, please. Next, what do biomedical engineers do? As mentioned in the last slide, biomedical engineers study, design, and develop products to provide solutions for major challenges in medicine. Biomedical engineers often work in teams with researchers, health and engineers from other disciplines to problem solve using their unique approaches in agencies, hospitals, medical research facilities, university research facilities, and manufacturing plants. Next slide, please. Here is a diagram showing the general workflow in this process. So first, it's identifying the medical challenge and the patients it may be of significance to. Second, analyze and apply potential engineering principles that are applicable to the project. Third, identify potential solutions and/or technologies that function to reduce or solve the medical challenges at hand. And fourth, develop and continue to maintain or upgrade the solution, all while working towards the goal of improving the quality of life. Next slide, please. Now, as you can imagine, in a field that tackles complex medical problems, there are many subdisciplines of biomedical engineering. This table over here definitely looks overwhelming, but they're basically just an overlap of different combinations of disciplines, such as mathematics, physics, chemistry, electrical engineering, mechanical engineering, and many more. And you might have already guessed this, but these specialties have subspecialties. Our focus for this presentation will be in a specific application of medical robotics. Next slide, please. But before we get into surgical robotics, let's quickly go over what medical robotics is. And we can start by asking, what are medical robotics? Medical robotics is simply the utilization of robots in medicine. And here are some common applications for medical robotics. First, let's start with biorobots. Biorobots are machines that imitate biological systems. For example, Robotuna, which is a robotic fish that was made by researchers in MIT in the 1990s. Disinfection robots, unlike biorobots, function to disinfect different environments. For example, the Adibot UVC disinfection. This robot is common in hospitals and environments with high infection rates. Pharmacy automation, on the other hand, provides a vital solution to enhance the speed of a task in a pharmacy. One such example is the Kirby Lester KL1 pill counter. Next, rehabilitation robots are machines that assist rehabilitation therapists to assist patients with movement. For example, the Locomat Pro Sensation. Next, surgical robots are robotic systems that perform surgical procedures. For example, the Intuitive Ion, which can perform robotic-assisted bronchoscopy. And finally, telepresence robots. These machines function in environments that are too dangerous for humans. For example, the Justice Security robot. Next slide, please. Surgical robots are also known as robotic-assisted surgery, perform surgical procedures through a robotic system and address limitations from traditional surgical procedures. Although it should be noted that this procedure may not be appropriate in all situations, and the implementation and usage depends on the governing bodies for the said country. Common surgical procedures include cardiac, colorectal, general surgery, head and neck, and thoracic. Next slide, please. Now, let's look into some of the benefits surgical robots have over traditional surgery techniques. Next slide, please. Overall, robotic surgery provides the benefit from open surgery, that is, cutting the skin and tissue to view the organs involved in the surgery, and laparoscopic surgery, viewing organs by making small incisions. That is, minimal invasive approach, which leads to lower blood loss and shorter hospital stays, as well as less trauma. It can also have a benefit in higher surgical accuracy and provide magnification or viewing the image in 3D. Next slide, please. The next benefit is reduction in surgeon fatigue. This is caused by the surgeon's working conditions, that is, high degrees of concentration required for a long period of time. This condition can prolong reaction time, reduce vigilance, and promote impaired decision-making skills, overall negatively impacting the patient's health and safety. Next slide, please. Now, let's look at the flip side of this technology, that is the limitations posed by this technique. Next slide, please. Robotic surgery and traditional surgery techniques have the same risks for surgical site infection, the symptoms for which include, but are not limited to, pus or drainage, fever or chills, bad smell coming from a wound, or redness and pain around the surgery site. The treatment for this infection depends on the severity of the infection itself and could either be treated using antibiotics or might even require surgery. On the right are the three most common culprits for this condition, Streptococcus, Staphylococcus, and Pseudomonas. Next slide, please. Most surgical robots being used are still prone to human errors. Some of these errors occur during planning, execution, following rules, communicating, and working in teams. Though there are possibilities to minimize such errors by having weekly meetings to analyze new cases, as well as identifying potential techniques that can be used to mitigate the risk. Next slide, please. There are some additional technology-related risks associated with robotic systems, electrical issues such as a loss of power or its quality, hardware issues, both examples of surgical systems. Next slide, please. The Da Vinci surgical system is one of the most popular surgical systems. It performs laparoscopic surgery, which is surgery made through small incisions, and it was first approved by the Food and Drug Administration, also known as the FDA, in the 2000s for some procedures only. The image on the right shows their latest model. Next slide, please. A more recent surgical system is the Senhance surgical system. This system also performs the same kind of surgery and was first approved by the FDA in 2017 for some procedures. So, what are the challenges and opportunities for the next generation of surgical robots? Next slide, please. A recent study by the Association of American Medical Colleges, which functions to represent different groups in medicine and also provides information about projected data trends, predicted that a shortage of approximately 54,000 to 139,000 physicians by the year of 2034. The image on the right shows both the upper and lower bounds to that value. This prediction provides a potential for surgical robots to help reduce the shortage, as well as bridging the gap between the shortage of physicians and surgical robots. Next slide, please. Implementing more features and progress in fully automated robotic surgery. Over the past year, the market has been dominated by a handful of companies. However, a growing number of companies are now creating competition in the market, which in turn could lead to the lower price of equipment, and in addition, provide hospitals with alternative options and a larger number of features. In addition to the changes in market for surgical robots, advancements and enhancements of types of surgical robots are performed. There are two types of robotic surgery: assistive, which is controlled by doctors, or fully automated, which does not require any human intervention. Currently, assistive robotic surgery is the more commonly approved technology. However, fully automated tools may be of interest for future needs. Next slide, please. So these are some of the sources I've used today to prepare my presentation. Next slide, please. And I'd like to thank everyone for their time and attention today. I can try to answer any questions you may have.
Hello.
Hello.
I am Professor Madhuri Joshi from India, Pune.
Hello.
Hi, Shefali. You
Hi.
have done a great job, and being so young, you have taken a lot of effort to give the overall spectrum of the robotic surgery. That's great thing. I congratulate you for that. And my only question is, are you further working in this particular area of research?
As of now, no, but I will be. I'm looking into applying for my master's pretty soon, so Yeah, it's definitely something I'm really interested in, and it kind of blends my previous experience or interest in engineering and my interest in science at the same point, specifically medical science. Yeah, so it's hopefully in the future.
All the best.
Thank you.
All the best. Yeah.
Thank you.
Good. Great day. Great presentation. Congratulations.
Thank you very much.
Well, one question in the fully automatic robotic surgery, what about the accuracy presently?
So I think that's one of the very big reasons why it's not a very common approach. It's complicated to replicate the thought process and the kind of different situations a surgeon might be based on his previous experience, and it's hard to model that towards a fully automated machine, and I think that's one of the barriers towards that. And I think they're definitely trying to look into how they can teach the machine itself on how to identify different factors that might be, and also increase the reaction time to certain situations. For example, a surgeon would be with a lot more experience and a lot more practice in this field, and can interpret different situations based on the experience.
So participants, if do you have any other questions? If you have any other questions, you can either type in your chat box or unmute your microphones and ask your questions.
Hello, Shefali.
Hello.
This is Soumya from Trivandrum. I
Hi.
have hi. I have a doubt like whether the risk of infection is more in the case of robotic surgery.
I believe the risk would be similar, but then again, it depends on this conditions at which the traditional sort of approach was taken in. So it depends on the hospital as well and the maintenance that they do, but it should be, based on previous researches, it is about the same. So there's no sort of discrepancy in that.
Oh, thank you.
Thank you.
Can I ask one more question?
Yeah, definitely.
Yeah. So there are two methods of robotic surgeries followed. That is fully automated and doctor assisted. So what do you think? What kind of surgery can be performed by this fully automated type of robotic surgery?
I think surgeries which have very sequential processes, definitely not the ones which involve your vital organs per se, or like something that can, if something goes wrong, can be pretty life-threatening. I'm sorry, I'm not aware of like surgeries that are, I can't think of off the top of my head surgeries that are very sequential, but I can definitely get back to you on that.
I think the minor surgeries can be carried out using this fully
Yeah.
automated, right? And
Yeah.
not the major ones like cardiac surgery. And
I imagine the ones being not having a lot of differences in the steps being more promising for fully automated, and ones which require more of on-the-spot thinking, or organs that can, if any issues or any technical issues happen, aren't life-threatening per se.
Okay.
Yeah.
Thank you.
Thank you very much for your question.
I'd like to ask.
Do you need?
Yeah, after you.
Yeah, Geoffer, you continue.
So, the
Yeah,
presentation was very.
one small
Yeah.
question. Lot of benefits you are told about robotic surgery or robo in medical. Is there any challenges and any demerits of this robotic surgery to the human being?
Well, okay, so I guess you can think of it as two aspects. So one can be something that was intentionally sort of miscalculated, or one can be just a technical issue. For example, when you're doing an incision, any sort of tremor or any sort of movement or any sort of electrical issue can damage nearby cells. So that's one of the risks that comes with um, robotic surgery in comparison to a real surgeon. And sorry, I'm blanking on your first part of the question. Can you repeat it again?
Yeah, no, thank you.
Okay.
So, what I would like to ask is, we
Hello?
have lot of budding engineers in this webinar now. So, what would be your recommendation or suggestion to them to proceed further in the field of robotics, being an engineer?
Definitely having a bit of or medicine specific related knowledge would be definitely helpful. And as mentioned before, in that huge table,